All right, so today we're diving deep into how smart healthcare is revolutionizing lung health.
Yeah, it's pretty remarkable how technology is changing the game for folks with lung conditions.
Absolutely. We've got a whole stack of research papers, reports, even a few news articles all about it.
What I find fascinating is the shift in focus from just treating illness to actually empowering people.
To manage their own health.
Exactly, giving them the tools and knowledge to take control.
Yeah, that's a big theme that jumps out from all this information.
Definitely.
And one of the first things that caught my eye was the rise of home-based pulmonary rehab.
Oh, yeah, that's huge.
I mean, imagine doing your rehab exercises in your living room, guided by an app.
It's all about convenience and accessibility, especially for those who have trouble getting to a clinic.
Right, and the research shows it can be just as effective as traditional rehab.
Sometimes even more so.
Why is that? Is it just because it's easier for people to stick with it at home?
Well, that's definitely part of it, but there's more to it.
I'm curious.
When you're at home, you're in a familiar environment surrounded by your own things.
Makes sense.
It can be incredibly motivating. And these apps and wearables, they provide real-time feedback and track your progress.
So you can actually see the results of your efforts.
Exactly. It's incredibly engaging.
I see some studies here about how even something as simple as a pedometer can make a difference.
Oh, absolutely. Even just using a pedometer can significantly increase daily activity levels in people with COPD.
Wow.
It's a small change, but it can have a huge impact on their overall health.
And we're not just talking about counting steps, right?
Right. Some of these programs use multi-sensor armbands that track energy expenditure throughout the day.
So you get a much more detailed picture of their activity level.
And how their body is responding to exercise.
That's really interesting.
It's almost like having a personal trainer with you all the time.
I like that analogy.
And that level of personalization is really what sets smart healthcare apart.
Okay, I've started to see the bigger picture here.
It's not just about generic advice. It's about tailoring treatment plans to individual needs and lifestyles.
Makes sense. So it's not just about exercise, though, right?
Right.
I'm seeing some stuff here about energy conservation techniques, too.
Absolutely. Smart healthcare goes beyond exercise into all aspects of daily life.
Okay.
For someone with a chronic lung condition, even simple tasks like housework or getting dressed can be exhausting.
Yeah, I can imagine.
These programs offer tips and techniques to simplify chores, use assistive devices, and pace yourself.
All to reduce exertion and avoid breathlessness.
Exactly.
Can you give us some specific examples so our listeners can really grasp what this looks like in practice?
Sure, something as simple as planning ahead and grouping tasks together can make a big difference.
Okay.
Instead of going up and down the stairs multiple times, do everything you need to do upstairs in one go.
Smart.
Think about using assistive tools like long-handled reachers to avoid bending over, or a shower chair to avoid prolonged standing.
These are all really practical tips.
And break down demanding activities into smaller chunks, taking rest breaks in between.
So you don't overexert yourself.
Exactly. It's all about working smarter, not harder.
I love that. These are things anyone can do regardless of their tech savviness.
You got it. Smart healthcare is about enhancing existing knowledge and techniques, not replacing them.
And it's not just about what you do, but how you do it right.
Absolutely. You'd be surprised how much insight can be gained from something as simple as a pressure sensor.
A pressure sensor, where would that even go?
In a chair or a mass.
Okay, but what could that possibly tell you?
Well, imagine a sensor that measures the time and heart rate changes during sit-to-stand movements. This can reveal a lot about someone's strength balance and even their risk of falls.
Wow, I never would have thought of that.
It's another example of how smart healthcare can provide valuable data beyond what we see in a clinic.
Okay, you've definitely piqued my curiosity about these sensors, but before we go down that rabbit hole,
Sure.
let's talk about another area where technology is making a big impact: airway clearance.
Oh, yeah, that's a big one.
I'm seeing a lot here about managing mucus and coughing.
This is where smart healthcare bridges the gap between professional care and self-management.
Okay.
Traditional chest physiotherapy techniques like postural drainage percussion and effective coughing, they're still incredibly important.
But they often require a visit to a respiratory therapist, right?
Exactly, and that's not always feasible for everyone.
So technology is stepping in to fill that gap.
Precisely, we're now seeing instructional videos and apps that guide people through these techniques at home.
It's like having a virtual therapist in your pocket.
Exactly, and it's not just about learning the techniques, but also being able to practice them consistently and correctly.
Which is key for managing conditions like COPD and bronchiectasis.
Absolutely, and for those who need extra help, there are some really interesting high-tech tools available.
Like what? I'm intrigued.
There are wearable, high-frequency chest wall oscillation vests, which basically vibrate the chest to loosen mucus. It's like a mini massage for your lungs. And then there are oscillatory TP devices, which use exhale air resistance to create
To
vibrations.
help clear the airways.
Exactly. Both of those have been shown to be really effective, for folks with COPD and bronchiectasis,
Yeah.
especially for improving lung function and their quality of life.
It's amazing how technology is giving people more options, more control.
It really is. And we're even seeing sensors now that can monitor breathing rate and patterns.
In real time.
Yeah, exactly, which is so helpful for people learning techniques like pursed-lip breathing or diaphragmatic breathing.
Oh, right, to help reduce breathlessness.
Yeah, exactly.
It's like having a biofeedback coach right there with you, helping you adjust your breathing as you go.
Yeah, it's pretty amazing that kind of instant feedback can be really powerful for learning and reinforcing those techniques.
Totally. Okay, so we've talked about home rehab and airway clearance, but what about sleep?
Ah, sleep.
Sleep disorders are so common with lung conditions, and I'm seeing a lot here about how smart healthcare is changing sleep breathing monitoring.
Oh, yeah, that's a huge area where technology has come a long way.
Okay.
Remember those old sleep studies where you had to spend the night in a lab hooked up to all those wires and machines?
I can only imagine, not exactly a recipe for a good night's sleep.
No, not at all. But now we've got wearable technology and we can get incredibly accurate sleep data from home.
From home. Wow. So no more sleep labs.
Well, in many cases, yeah, you don't need to go to a lab anymore.
That's amazing.
It's made getting diagnosed and treated for sleep apnea so much easier and more accessible.
That's great to hear. So what kind of devices are we talking about here?
Well, there are patches you can wear on your chest, wristbands, even rings that track things like heart rate, breathing patterns, oxygen levels all throughout the night.
Hmm.
And they capture incredible detail. There's this small chest patch that can accurately diagnose sleep apnea just by detecting subtle changes in breathing and heart rate variations.
Wow, technology is really amazing. So what about folks who don't want to wear a device all night? Are there other options?
Yeah, actually, there's some really cool non-wearable technologies emerging too.
Oh, really? Like what?
Well, there's millimeter wave radar.
Millimeter wave radar.
Yeah, you can put it beside the bed, and it uses electromagnetic waves to detect even the tiniest chest and abdominal movements.
Wow.
It's super sensitive and can pick up on breathing irregularities and apnea events without even touching the body.
That sounds incredibly futuristic, but it's here now helping people sleep better and manage their health. What else is out there?
Well, there's another one, fiber optic sensors.
Okay.
Imagine a mattress with these sensors woven right into the fabric as the person sleeps. These sensors detect pressure changes,
Okay.
and they can actually create a map of their breathing patterns and movements throughout the night.
It's like having an invisible sleep detective gathering clues about your breathing.
It kind of is, and what's really fascinating is the amount of data all these technologies are collecting.
All right.
Yeah, it's huge, and that's one of the most transformative aspects of smart healthcare, this ability to gather continuous real-time data, that goes way beyond what we could get from just a one-time snapshot in a clinic.
Right. So we're moving from episodic care to continuous monitoring.
Exactly, and that continuous stream of data, it opens up so many possibilities for early detection, for personalized interventions, for a more proactive approach to managing your health.
Okay. I'm definitely seeing a theme here. More data, more personalization, more empowerment. But let's get specific now. What are some of the key areas where smart sensors are being used for physiological monitoring in lung health?
Well, think about all the things that are important for understanding how someone's lungs are working, their breathing rate, the depth of their breaths, their cough frequency, even the subtle vibrations of their chest wall. We now have sensors that can capture all of that in real time, continuously.
Okay, so paint me a picture here. What are some of the different types of sensors being used?
Well, there are smart vests with built-in sensors that measure changes in chest circumference to calculate breathing rate. And then there are wearables with accelerometers and gyroscopes that can detect those tiny chest movements and cough vibrations, to understand breathing patterns.
It's fascinating how much our movements can reveal about our health.
It really is, and researchers are always pushing the boundaries. There are studies using mini radar inductive coils and impedance measurements to track breathing cycles and lung volume changes.
Wow.
And we're even seeing light-based technologies like fiber Bragg grading sensors and photoplethysmography, which use light to sense chest movements and calculate respiration and heart rate.
Okay, some of this is going a bit over my head. What exactly are fiber Bragg grading sensors?
They're pretty cool, actually. They're these tiny optical fibers that reflect different wavelengths of light depending on how much they're stretched or compressed.
Okay.
So when you embed them in a wearable device, they can detect even the smallest movements of the chest wall, giving us really precise measurements of breathing.
Okay, that makes sense. It's amazing how something so tiny can provide such detailed information.
I know, right? And we can't forget about diaphragm EMG electrodes, which measure the electrical activity of the diaphragm muscle.
Okay.
This gives us a direct look at how hard those breathing muscles are working, which can be really valuable for understanding how severe someone's lung condition is.
So we've got all these sensors gathering data about breathing, but it doesn't stop there, right?
Nope. One of the key insights from all this data is that lung health is connected to overall health and activity levels.
Right.
So a lot of these smart healthcare programs, they're incorporating activity trackers that measure things like steps, daily activity balance, and gait.
I could see how that would be important for people with COPD.
Absolutely. We know that regular physical activity is crucial for managing COPD and preventing those exacerbations, but it can be challenging for people to stay active.
Yeah, for sure.
These trackers provide motivation feedback and a sense of accomplishment that can really help.
It's all about making those healthy habits easier to stick with.
Exactly. And sometimes it's not just about encouraging activity, but also about assessing functional abilities.
Okay.
Like there are pressure sensors that can be built right into seats. These sensors can automatically time how long it takes someone to do a sit-to-stand test, which gives us valuable insights into their lower limb strength and balance.
So it's like having a built-in physical therapist evaluating their movement. That's clever.
Yeah, it is. It really highlights how seamlessly smart healthcare can be integrated into everyday life.
Okay, so we've talked about the types of sensors and the data they collect, but what makes all this continuous data so valuable? How is it actually being used to improve lung health?
Well, one of the most promising applications is in monitoring lung function. We can now analyze things like cough sounds and frequency as a substitute for pulmonary function testing.
Wait, so a cough can tell us more than just that someone's sick?
Absolutely. Changes in cough frequency or the sound of a cough can actually signal that a lung condition is getting worse or even that an infection is starting. By analyzing those coughs, we can potentially detect problems early and intervene before they become serious.
That's incredible. It's like our bodies are sending out these signals, and now we finally have the technology to listen.
Exactly. And continuous breathing pattern monitoring, that gives us real-world insights that go way beyond what we can learn from a one-time spirometry test in a clinic.
Right, so it's giving us a more holistic and personalized understanding of how someone's lungs are functioning in their everyday life.
Precisely. And this real-time data, it can be really powerful for early intervention. Imagine a system that alerts a doctor if a patient's activity level suddenly drops, or if their breathing rate becomes abnormally high or irregular.
Yeah.
That kind of early warning system could be life-saving.
Look at having a virtual guardian angel looking out for your lung health.
Yeah, it kind of is okay, so you're convinced about the potential of continuous monitoring.
Definitely. But let's shift gears a bit now and talk about artificial intelligence, or AI.
Oh, yeah, AI.
I'm seeing a lot of buzz in these sources about how AI is being used to analyze all this data and create more personalized treatment plans.
AI is definitely shaking things up in a big way. One area where we're seeing a lot of progress is in analyzing electronic health records.
Okay.
By applying AI algorithms to these huge data sets, we can start to uncover hidden patterns and insights that would be impossible for humans to detect.
It's like having a superpowered detective combing through mountains of medical data to find those crucial clues.
Exactly, and this is leading to some really exciting advances in personalized medicine, for example. Instead of treating everyone with COPD the same way, we're starting to identify distinct subgroups of patients with different needs.
So we're moving away from a one-size-fits-all approach.
Precisely, AI is helping us tailor treatment plans to the individual based on their specific symptoms, medical history, lifestyle, even their genetic makeup.
That's incredible. Can you give me an example of how this is actually being used?
Sure, there was a study that used machine learning to cluster COPD patients based on a whole range of factors like BMI, medical history, other conditions, mental health indicators, even blood biomarkers.
Wow, that's a lot of information.
It is, and what this study found was that there were distinct clusters of patients with different characteristics and needs.
Okay.
That knowledge is so valuable for developing more targeted and effective treatments.
It's like creating a custom-made suit for each patient, ensuring the perfect fit.
I like that analogy. And AI isn't just helping doctors make better decisions, it's also being used to create medical chatbots.
Chatbots, like the ones you see on websites that answer basic questions.
Similar, but these medical chatbots are much more sophisticated. They're designed to give advice and support to patients and even to medical professionals. Imagine a chatbot that's been trained on all the latest COPD guidelines, sleep apnea care protocols, and pulmonary rehab plans.
So it's like having instant access to a medical expert any time of day or night.
Exactly, and they're getting more advanced all the time. They can answer questions, provide educational materials, even offer personalized advice based on someone's situation.
That sounds like a really valuable resource, especially for people who might not have easy access to healthcare professionals.
It is, and while chatbots will never replace human interaction, they can be a vital tool for providing quick and reliable information, especially when it comes to managing chronic conditions.
Yeah, it seems like a natural fit for smart healthcare, where access to information is so important.
Absolutely. And speaking of access to care, we can't forget about telemedicine and remote monitoring in
Oh
pulmonology.
yeah, telemedicine has really exploded in recent years, especially since the pandemic.
It has, and for people with lung conditions, it can be a real game changer. Imagine being able to have a video consultation with your doctor from home without having to travel to a clinic.
Yeah, that's so convenient, especially for folks with mobility issues or who live in rural areas.
Exactly, and it's not just about consultations. Remote monitoring devices allow doctors to keep track of patients' vital signs and lung function in real time, even when they're miles apart.
It's like having a virtual doctor on call 24/7.
In a way, yeah, this kind of technology is especially important for people with chronic lung diseases and those who need long-term respiratory support.
It must provide peace of mind knowing that help is always just a click away.
It does, and it allows for earlier intervention if any problems arise. A doctor can adjust oxygen therapy settings or even arrange for hospitalization if necessary, all remotely.
Wow, it seems like telemedicine is a perfect complement to all these other smart healthcare technologies we've been talking about.
It is together they're creating a more integrated and patient-centered approach to lung health.
It's amazing to think how far we've come in such a short time and have a feeling this is just the beginning.
Oh, I agree. I think we're just scratching the surface of what's possible with smart healthcare. The potential to transform the lives of people with lung conditions is truly limitless.
We're back and ready to wrap up our deep dive into smart healthcare and lung health.
Yeah, it's been quite a journey exploring all these incredible advancements.
We've covered a lot of ground, from home-based rehab to AI diagnostics.
And it's clear that technology is really changing the game for folks with lung conditions.
Absolutely. And what strikes me is how smart healthcare is shifting us from a reactive approach to health.
To a more proactive and preventative one.
Exactly. It's like instead of waiting for symptoms to appear, we're now using tech to monitor our health
Identify those potential problems early on.
and take steps to stay ahead of the curve.
Right, it's like a constant feedback loop empowering us to really take control of our well-being.
I like that, a constant feedback loop, and that's especially important for chronic conditions like COPD, right?
Absolutely. Early intervention can make a world of difference.
So can you give us an example of how this plays out in practice?
Sure, let's say someone with COPD is using a wearable sensor that tracks their activity levels, breathing, and cough frequency.
We talked about those earlier.
Right now, let's imagine the sensor picks up a slight increase in coughing overnight,
Okay.
or maybe a little dip in their usual activity level.
Those could be early signs that something's up.
Exactly. And with smart healthcare, that data goes straight to their doctor.
Okay.
And the doctor can then reach out to the patient, see how they're doing, and figure out what's going on.
It's almost like having a virtual doctor on call 24/7.
Yeah, in a way, and that early intervention can be crucial.
Right.
It could be something simple like adjusting their meds or suggesting a few days of rest,
Right.
or it could be a sign of something more serious that needs attention right away.
Either way, it's so much better to catch it early.
Absolutely. And this proactive approach isn't just about managing existing conditions.
Right?
It's also about preventing lung problems from developing in the first place.
Now that's really exciting.
Yeah, it is.
I'm picturing wearable sensors that can monitor air quality
Right.
and alert people to environmental hazards.
That's definitely a possibility. We're also seeing AI being used to analyze genetic data to identify individuals who might be at higher risk for certain lung diseases.
So we could potentially intervene even before any symptoms show up.
Exactly. It's about using technology to build a healthier future for everyone.
So speaking of the future, what are you personally most excited about in the world of smart healthcare for lung conditions?
For me, it's the potential for even greater personalization in treatment.
Okay.
Imagine treatments tailored not just to your condition, but to your lifestyle, your genetic makeup, your environment, even your preferences.
Wow, that sounds like the ultimate in customized care.
It is. AI and machine learning are giving us the tools to analyze huge amounts of data and create truly individualized care plans.
So it's moving away from that one-size-fits-all approach
Yeah, exactly.
to treatments that are as unique as the people they're designed for.
Exactly. It's about moving beyond treating the disease to treating the person.
And what kind of impact do you think this will have on people's lives?
Well, I believe it'll lead to better outcomes, improved quality of life and a more sustainable healthcare system for everyone.
I'm excited to see how this all unfolds. It feels like we're at the very beginning of a really exciting journey.
I agree. And as we wrap up this deep dive, I want to emphasize that while all these technologies are incredible, they're just tools.
Okay.
The real power is in our hands.
In our own hands.
Yeah, it's up to each of us to be proactive about our health, to stay informed, to ask questions, and to advocate for ourselves.
You're absolutely right. Knowledge is power, and in healthcare, it's the most valuable thing we have.
So let's all empower ourselves with knowledge and take charge of our lung health.
To a healthier future.
Cheers to that. Thanks for joining us on this deep dive into the world of smart healthcare and lung conditions. It's been a pleasure.
And remember, folks, this is just the starting point. Keep those questions swirling, keep learning, and keep exploring all the incredible possibilities out there.